October 30th. Again, so you need to make sure you have that provisional investigator ready. And 10.1, of course, is the full implementation of the REM system for investigations that for all waivers and those choices waivers that are ready and have a provider investigator. Otherwise, they will join our system on January 1st. These timelines are still available to you on the grid. They were presented last FAQ, the last WebEx session, and they're on the FAQ section on August 13th. Thank you, Teresa.
Sorry, Vicki, I apologize. I have a new headset, and apparently it is much smarter than I am. There are a couple questions we received into the REM mailbox this past week that are not REM related. So one is about the current DIDD AOD on-call number, and that will be addressed by program operations. So we'll pass that question along to them to get an answer for you. And the second question had to do with agency death review and notifications. That is a clinical services function, and they will be addressing it through integration. And so we will pass that along to them to get you to get with you guys with an answer. I just didn't want anyone to feel we were ignoring their questions. The first set of questions, though, are for Amy. Amy, is Amy in the panelist now?
She is.
Okay, thank you. Amy, would it be possible for 2 provider investigators to work one investigation? Amy, if you're speaking, you're muted. Okay. Vicki, I'm not sure what's happening.
Amy, I have unmuted you. You're ready to go.
Oh, thank you, Amy.
Okay. Am I here? Yes.
Yes, we can hear you.
Okay, great. Yes, a provider can choose to utilize 2 provider investigators for one investigation for a couple different reasons. You could have someone with lesser experience that is being mentored by a more experienced investigator, or you may have a system where one investigator does the field work and the other does the virtual interviews and writes the report. You may also have someone working across multiple regions that needs assistance with pieces of the investigation from another region. There are no restrictions on how you utilize your staff once they've met the qualifications to be a DIDD approved provider investigator.
Thank you, Amy. That's helpful. Amy, the next question is a little bit longer, so bear with me. The provider talks about how they like the new report template, but they do miss the summary. They scan through the one system protocol looking for guidance regarding notifications that come following the closure of an investigation. They did not see anything similar to our current requirement for 1915Cs of within 15 days of receipt of the final investigative report, the provider shall notify the person investigated in writing of the outcome of the investigation. And within 15 days of receipt of the final investigative report, the provider shall discuss the outcome of the investigation with the person supported and invite the person's legal representative, if any, to participate in this discussion. This meeting shall be documented by the provider. Amy, will these still be requirements in the new system?
The providers are no longer subject to the DIDD provider manual. That section quoted in the question is from Chapter 7. Each managed care organization will have their own provider manual, and the MCOs are working together to ensure that all 3 have consistent requirements.
Thank you, Amy. Okay, now, and next question is the provider asks, they assume they're still responsible for making these notifications. Is that correct? If so, why is it not in the protocol? Amy? This is to the person supported.
With the person supported, correct.
Yes, ma'am.
This is detailed in the provider event management coordinator's training and responsibility.
Thank you. And then they ask, should we create our own format for sharing the findings, incidental information, for the conservators and people they support? Amy?
The provider must provide documentation of their notification and what was shared. The IDD is not mandating how the providers document this notification.
Yeah.
Previously, the IDD investigations had a template to providers as a courtesy. Since the modification for the Tier 2 investigation report to meet the provider's request does not include a summary page, providers will be responsible for creating their own template. This will be reviewed by the regional offices and the MCOs. Should there be a need to address the provider's manner of notification, that will be done one-on-one by one of those reviewing entities.
Thank you, Amy. Follow up to that. If we create our own format, am I correct in understanding we can only relay the name of the accused when applicable and the name of the alleged victim in the one sentence conclusion statement? I might need some reminders about what we cannot share with the alleged victim and their conservator.
Only the identity of the person supported is protected, since this is a notification to the person supported or the family member with a legal right to PHI. Sharing their name is not an issue. The conclusion of the investigation as it relates to that person should be shared with them. In addition, the informational findings should be discussed and the provider's response to those findings. Skyland, did you have something you wanted to add to this?
I did. From an MCO perspective, I think this is a great question, and we, first of all, thanks for reaching out to the person and the legal representatives and/or the primary contact. Of course, as you have consent, we know that you're doing that. We know that providing that type of information or this type of information, whether it's, to outreach from a Tier 1 investigation or even a Tier 2 investigation, that information with whatever you're relaying, whether it's substantiated or unsubstantiated, can oftentimes be a little bit of an uncomfortable, conversation and responsibility. So we really do appreciate you reaching out and taking that initiative. We appreciate the open communication with those that we support, as well as the family member, and consider it best practice to continue to do what you're doing. It's considered, to be quality services provided for the overall health and safety of those that we're supporting together. We encourage you to continue to outreach to your MCO reportable event management teams, me and Leanne and Jamie, the faces you're used to seeing, as well as our counterparts within our teams that you may not see on a regular basis during these WebExes. We're all here to help you as well work together. But we also wanted to let you know that we too are providing that outreach. Our support coordinators, our care coordinators are reaching out to our families and intend to, from a care coordination perspective, to just make the person aware of the status to investigate, so that we're helping the person to be more comfortable in understanding that there may be an investigator that you've never seen before or met, right? To help them to understand that they may be asking you questions, and it's okay to answer those questions. As well as following up and providing that outcome of investigation. We're not providing outside documentation or the summaries of investigation per se, but we are letting the families know and the person know of the status of the investigation, simply that it was substantiated or not substantiated. And we're also working with our providers to ensure that that continued follow-up and remediation is there. So just wanted to provide that on the other side of the spectrum. While you guys are doing this your side in this part and reaching out to the person, as are we. And so we just wanted to make sure that we're all working together as a team with continuing forward with that effective communication and ensuring the health and safety of the person is number one, which we're doing, and I very much appreciate your collaboration in that as well.
Thanks, Skyland. I agree with what you said, and here at Blue Care, we're fully supportive of ensuring the health and safety of our members and appreciate our providers and their communications. Just to clarify, the MCOs at this point, we do not send out any letters or written information to either the person supported or to the individual who is being investigated. Right now, all that outreach would be happening just through our care coordinators or support coordinators, usually verbally, but no written documentation is going to go out from the MCOs at this point.
Thank you, Leanne and Skyland. Amy, I think one last question for you. Are agencies required to send ISCs non-reportable events? We send ISCs these events if requested, but it has been reported by ISCs that they should receive all events, including non-reportable events. Clarification is requested.
It is not a reportable event management requirement for non-reportable rests to be submitted to the ISCs.
That was an easy one for you, Amy. Thank you. Skyland, do you have anything additional you'd like to add?
Sorry, I was having a hard time coming off mute today.
It's really
Um,
hard.
I mean, all these buttons. Okay. So while non-reportable events, do not require a reportable event form, the expectation is that, our providers are still addressing the event or the concern. We know you are, and just following up with those outside entities, meaning, if you need to follow up with the PCP, any behavioral health, any clinicians, that's all still being done. Just because it doesn't have to be, reported on a reportable event form doesn't mean that the expectation that that it ends there, right? So the expectation is that we're continuing to follow up, discussing it with the support coordinator, the ISC, the care coordinator, the state case manager, whomever it may be, depending on which program the person is in. Just so that those events are being tracked and trended. Remember that non-reportable events are supposed to be addressed during the PRE or TR meetings, and your tracking and trending and remediations are happening depending on your trend analysis as well. And you can always reach out if you have questions regarding that process or regarding the event itself to your reportable event managers here at the MCO, depending on who is represented for that person in question.
Thank you, Skyland. And don't go too far. The next set of questions is for the MCOs. So whoever would like to take this one. It is so hard for choices providers to ensure all required training is completed when it continues to change, not to mention paying staff for all of the time spent on this new required training. The latest memo states in revised training requirements, the reportable event training for DSPs and support staff has been shortened from 1.5 to 2 hours to 1 hour only. Where is this training located?
I can take that one. The training is located out on Relias, and the links are out there in the resources and the training information out on the website.
Thank you. And the person says, I ask this question because the RET training course in Relias has been required, is and always has been a 3-hour course.
This is Leanne. I need to go back and just add a little bit to the question I just answered.
absolutely.
Sorry about that. So yes, you can access the information via Relias, but there's also the option for train the trainer. So there's a course where you can have someone take the course and be educated as a trainer, and then provide that in person or however you decide to do that with your staff. But I forgot to mention the train the trainer. So for the next question is, it's been required and it's always been a 3-hour course. The hours that are reflected isn't necessarily the amount of time that it's going to take you to complete the course in Relias. It's a self-paced course, so we all work at different paces. So it may take you an hour, it may take someone else an hour and a half. So that's going to vary. So that's the difference there.
Okay, so again, where is the course that was 1.5 to 2 hours and is now only 1 hour to be completed by 9/1/2021? I think this may go to the different timelines for choices, Leanne or
Okay.
Skyland.
I'll go ahead and just grab that one too. Again, if your choice is only provider, you have until 1/1/22 to complete all the training requirements. So the only time frame requirement that has changed is for choices only program providers, and that's just going to be a time to allow for additional training to be completed through 12/31, so everything can start on 1/1.
Thank you, Leanne. Next question. The section doesn't mention the reportable event management coordinator training at all. Is it still required for choices provider administrators?
Do you want me to take this one, Leanne? Give you a break.
You can have it, Skyland.
So reportable event management coordinator training, which is also slash PRERT training, is still required by those who act in the role of the EMC and or backup to the EMC, so the event management coordinator.
Thank you, Skyland. Next question is for Elizabeth. Liz, I am the EMC event management coordinator and am confused about what documentation is supposed to be sent to MCOs when I submitted a portable event form. DID does not require additional documents. It seems like every MCO has a different request regarding documentation. Documentation is not something I always have access to when submitting the ref. If I have to look for additional information to submit with the ref, this may delay the timeliness of the ref being reported for those programs. Why isn't it the same across the board?
Sure. So keep in mind that DIDD does not require that any supporting documentation be submitted with the ref to DIDD or the MCO. And this is to make sure that the event is reported timely. However, after a review by DIDD and or the MCO, additional documentation may be requested. This is the only instance that we've been made aware of that this was an issue and an error was done during the MCO staff learning the REM system and their roles. So this shouldn't be an issue moving forward.
Thank you. Would the MCOs like to add additional comments to that question?
Well, I have something additional to add. I think that this may have been like an opportunity for like miscommunication, because I know it's understood jointly that anytime after the submission of an initial reportable event form is submitted, the MCO may reach out to the provider seeking clarification or request of submitting documentation. This is all, of course, excluding those events with ongoing investigation status. So outside of those, we may follow up and ask for supporting documentation to be submitted after the reportable event form, just for clarification purposes and, to know what our next steps could be from an MCO perspective. So it is a joint practice that all three MCOs operate the same in regards that we do not want to hinder timely submissions of reportable event forms. And expect providers to submit those REFs as the reporting process requires for the appropriate event classification. So those meaning Tier 1, Tier 2, or additional reportable events. So we would not ask nor expect providers to delay the submission of a reportable event under any circumstance. So please don't, I guess, understand us to be asking you to send in reportable information supporting the event before you send in that reportable event form. We would not ask that at all. If you have supporting documentation like hospital admin documentation or discharge documentation, maybe an accident report from a traffic citation, any of that, drug screening, at the time of the submission of the reportable event form, send it in. That's fine. But please feel free to send that with the reportable event form, but don't feel like you have to wait on that information before you send the reportable event form, because that is certainly not what we're asking. We may ask for that later, but we don't want you to delay your submission at all in sending in your reportable event form. The expectation is that our providers are always submitting the reportable event form within 1 business day of witness or discovery of that event.
Thank you, Skyland. Liz, please clarify the reporting of medication variances. If a person does not receive a medication and they have no adverse side effects or require observations, this is non-reportable. Is that correct?
That is correct. So in this situation, a ref is not needed because a PCP or a medical professional did not require that the person supported be observed and there was no adverse side effects.
Thank you, Liz. Now, do these things fall into the consolidated reportable event form reporting monthly? None of these are written in BSPs or behavior guidelines, but are mentioned in the person's ISP about the need. First one, Liz, I wear a helmet because I have falls due to seizures to protect myself from head injury.
So this would not meet our definition of protective equipment because this is not a behavior safety intervention or a restrictive behavioral procedure because it's related to seizures, which are medical. It is not related to prevent tissue damage or physical harm due to a person's behavior, such as if they were headbanging, doing self-injurious behavior.
Thank you, Liz. Second example, I wear a chest harness and seatbelt on my wheelchair because I have a wheelchair which has been molded to my body, and the harness and seatbelt helps me keep proper alignment. We do have human rights committees on these, and I wear a seatbelt and or harness on my shower or in toilet chair because I am unable to hold myself in the chair without them. We also have HRC approval for these.
Okay, so these would not meet our definition of a mechanical restraint because it's not a behavior safety intervention or restrictive behavioral procedure since it's related to positioning, which is medical or therapeutic. It's not related to reducing or preventing a behavior or an ongoing risk of harm, such as elopement or physical aggression.
Thank you. The third example, I'm going to the dentist's office and take pre-sedation medication and or receive IV sedation because I will not hold still, cooperate for the procedures to be done. We do have HRC approval on these. Liz?
Okay, so if the provider agency is administering the sedative or the psychotropic medication, and it is used routinely, which means it's given prior to every dental appointment, then it's not considered an emergency psychotropic medication. If the medication is not routine, but it is used as needed if there is agitation occurring, for example, it would be considered emergency psychotropic medication, and therefore it should be reported each time that it is used.
Thank you, Liz. And that is the end of our pre-submitted questions. So we're going to move on over into the chat box. In the first question, Vicki, I think I'm going to you because I don't believe that Tiffany with an I is here today. First question is it possible for us to select the person we want to work with for our training? And I'm
The answer
assuming
to that
this
is no. Yeah, I'm assuming the only training that we're having is with Tiffany Alley, who is running the investigations training portion. That's both for train the trainer as well as the provider investigator training. We do have additional staff that are assisting her in the provider investigator training, but those are on a rotating basis as she needs them to assist. So Tiffany Alley is our investigations training specialist, and she's our primary trainer.
Thank you, Vicki. The next question is for the MCOs. When will the agencies, ISC agencies, or agencies/ISC agencies receive the provider manuals that go into effect on 10/1/21? Come on, Skyland, you always got something for me.
I mean, I have something. I don't know that I have an answer today. I'm not sure of that answer. I think that we can get back with you on that. I'm not sure. I know that that is all part of the integration side of things.
Yeah, this is
so can we check that?
Shannon.
Oh,
Etsy.
good.
Yes, I can't really share a day either, but they're in their process, right? They're going through our approval process, and I don't know that we have a date, but you'll certainly have those for the integration.
Thank you, Shannon. It's very helpful. I don't see any other questions in the chat box, so we can give folks a minute. I'm really thinking the next WebEx we have is going to be, well, it will be after the 9/1 date. So at that point, I'm hopeful that y'all will have some questions since we'll have started the system and we'll be able to use that time to help assist or answer any of that. Oh, next question is Shannon. I think this is for you. How much does it cost to sign up a second employee to become a provider investigator? Do you turn in 2 forms by tomorrow? Well, that's for the 1-day investigator or just 1 form. Well, I think that's the 1-day training, right? And that training, we're just doing that training. But I think the question about when you have to pay for that second employee would go to the TQI training. So Shannon, do you want to answer that?
Yeah. Yes, I'll answer that. And then I don't have a set answer, but I can share some information with you. So the TQI training is being finalized through the pilot. We're in the very last stages, but we don't have that final cost for the second investigator at this time. We'll note that, make sure that when we have that, we'll share that. But part of that was that we were making sure we had the final information of how long it took people to go through the pilot, and the assessment piece and how long it was taking for the assessment piece for the second investigator at this time. And Vicki can correct me if I'm wrong, but we're really focused on getting one investigator in for each agency. That's our priority at this time.
Thank you, Shannon.
Yeah, we are actually allowing multiple people to attend from the same provider, so that let's say perhaps the provider's not sure which person that they want to be their primary investigator and would send through TQI or quilts. So we are allowing them to send multiple people through the provider investigator training if we have space available. So if you have a second person that you would like to send through, go ahead and submit their names, and we will go ahead and send them through the training as space is available.
Thank you. And Janet Niehoff has been kind enough to tell us that there are questions in the chat box, but they're being sent to all panelists. I'm sorry, all attendees, as there doesn't seem to be a everyone option, which there usually is one, but it's kind of in an odd place where it's between the panel and the attendees. But I've asked Janet, I've asked Janet if she could cut and paste the questions that she is seeing so we can try to answer those. And we really appreciate it. Next question, and I think we're going to, I'm going to go to either Leanne or Skyland, whoever would like to answer. Since we are a choices only provider, do we have to investigate an incident that occurs outside of our service delivery times?
I'll answer. Yes.
Thank you.
Yes, if you are made aware of an event, you need, and it's a reportable event, then it requires you to report it. Correct, Liz? I know it's kind of vague. But if an event occurred and you were made aware, then you need to report it if it's a reportable event.
Correct.
Okay, thank you, Skyland. Next question. I'm going to go to you, Liz. Will the reportable staff misconducts be phased out on 9/1/21? There was not an option for RSM on the new reportable event form.
Reportable staff misconduct, known as RSMs, are not reportable to DIDD. That doesn't mean that you wouldn't do your own internal tracking for those type of incidents or events, but it is no longer required on a rep.
Thank you. And I'm going to come to you, Shannon, with this next question. Being an all choices provider, we do not have to get investigator training. That is how I read the 10 care. I'm sorry, keeps bumping. That's how I read the 10 care memo dated 8/25. Do you want to provide some clarification for that, Shannon?
Yes, I will. So you do, a choices only provider does have to get the provider investigation training. And and that final deadline for you to do so is on January 1st. And that's when you have to start doing your tier 2 investigations. Prior to that, you have the opportunity to go through the 1-day provisional training. That's the training that Vicki was mentioning at the beginning of the WebEx today that you have until tomorrow to sign up for. And then the last training date for that is September 9th, but you have to sign up for that by tomorrow, August 27th. And the 1-day provisional training, just to remind you, allows you to go through a once you take the 1 day, then when you take the TQI, you have a modified module set for the TQI. So it's shorter. There's 5 modules. If you don't go through the 1 day provisional training, then you'll need to take all 7 modules. If you go through the 1 day provisional training and you start training and doing tier 1, start doing tier 2s for your agency prior to 1/1/2022, that you'll qualify for some of those quality incentive payments. Is that helpful?
That's really helpful. Thank you, Shannon. Next question, and Skylin or Leanne. It's a busy day for the MCOs today, so we appreciate having you here. Should the MCO reach out to the event management coordinator for needed information or to the case manager of the enrollee? Also, I've noticed that several others are added to the email asking about discharge summaries, the PRERT, follow-up appointments, etc.
I can give it a stab, and then Leanne, you want to jump in? So from an AmeriGroup perspective, oh goodness, all the above. I don't know. So usually if there's a response from me personally, from ECF, hi Kim, we chat a lot often, I'll respond back to whomever initially sent the reportable event form to me. So if I have questions and I'm reaching out, if you do see other people added, it's usually our internal people. So it usually would consist of the support coordinator, as well as provider reps, and then probably the member advocate, because we're all looped in, because we do have internal conversations to all work together to help with follow-up or any other concerns that we may have to help the person and the provider in whatever that event may be. So that may be why you see other people added on there that may not have initially been on there. It's really just kind of a teamwork effort. It's not anything punitive or to fuss about that we're being fussy or anything. It's just to kind of have everybody all in the same conversation thread, if you see that, and it's from an AmeriGroup perspective. But usually we do just try to reach out to whoever submitted that reportable event form to us. If we're submitting questions to the wrong person, please feel free to direct that back and say, hey, Skylin, this is going to the wrong person. We're going to forward that, or adding so-and-so in. Please forward, any further communication to this said person. That works better for you.
Thank you, Leanne. Thank you, Skylin. Leanne had sent an email that she had been bounced off the WebEx, so I'm not sure if she's back yet. So you may have to field a bunch of more questions during this time, so appreciate it. The next question, Liz, where do we get a copy of the new ECF reportable event form that we use as of 9/1/21? And will this be available through Relias?
Okay, so the ref is located on the DIDD REM website, which if someone could put that link in the box for me, I'd appreciate it. And it is not just a ref for ECF, it's a ref for everybody. I just want to make that clear. As far as will trainings be made available through Relias? Yes, there is a reportable event training that is available in Relias right now that you can take.
Thank you, Liz. And just to clarify, the reportable event form, though, is not available in Relias. Relias is just a training platform, and the form is available on the DIDD website. Thank you.
Yes.
All right,
Yes,
don't go anywhere. We got a follow-up. Will we continue to need to complete and submit the COVID-19 positive test report form with the new reportable event form after September 1st?
Yes, you will see on the reportable event form that positive COVID test is a category that you can check and report to us.
Thank you, Liz. And I do want to say how important that has become, especially in the recent wave that has been happening. All that information is used by, I know it's used by the MCOs, and it's also used by Dr. Davis here at DIDD to track and trend and to do outreach in certain places we may see the need for, to try to help get vaccination events set up and get tests to provider agencies that may need to have tests, because tests are still available. So remember that and reach out to us if you're in the need of, if you're in need of testing, or if you'd like to set up a vaccination event. And Dr. Davis would be more than happy to help you. So next question, And Janet, I want to thank you personally for doing this. I really do appreciate it. And I'm sorry that WebEx and that 2-box can be so dang confusing for people. For me, I think it changes depending upon whose account is being used, where things are located. A person, is this reportable to DID or not? A person supported strikes a staff person. There is no injury to the staff person. There is no intervention before, during, or following the event. Liz, is this reportable?
In that example, no, it is not reportable.
Now, Vicki, since there's today and tomorrow, I think people are scrambling now to get someone registered. I think these days have snuck up on us. I cannot believe August is almost gone, but where do providers find the available dates for the one-day provider investigator training?
So I will post right now the REM WebEx or the REM memo that identifies how to register for that. And it was also an open line. But those trainings are only Monday, Tuesday, Wednesday, and Thursday. And the reason for that is that it's an open book test, and you do not have to submit your test until the next business day to give you plenty and ample time to respond to those questions on the test. So between now and September 9th, you can register for 3 days of your choosing, as long as space is available. And that's for any Monday, Tuesday, Wednesday, or Thursday between now and September 9th.
Thank you, Vicki.
Send that email to the DIDD REM help desk, and I will post that in the box right now.
Thank you so much. Shannon, I'm coming back to you with the next question. Will choices only participants get the incentive?
Yeah, the quality incentive payment for the training is to all the HCBS providers. So that's if they participate in, in the training and complete the training as the incentive is defined. And
thank you so much, Shannon.
Yeah, there'll be more details on the quality incentive payments. Those are still being finalized.
Thank you. Vicki, per the reportable event management memo dated 8/20, our company is currently registered. I submitted our preferred days in an email to the REM mailbox. Will we need to wait until we get a reply to access the REM provisional one-day provider investigator training? Will we still be able to complete the REM provisional one-day provider investigator training after 9/9 if we do not have access until after this date?
So everyone that has submitted a registration form has been assigned the specific date and would have received a response email with the training packet with all the material that you'll need to download and review. You can print it, do whatever you need to, and review that training material prior to your attended class. But you will receive that packet and the date that you are scheduled to attend based off the 3 dates that you provided in the first available based off your request.
Okay, Vicki, I think
and no, the training will not be available after 9/9.
Vicki, I think we may need to provide a little clarification here. I think there may be some confusion. The one-day provider investigator training, that is not a Relias-based training. Can you explain how that training is conducted? I think people think they're going to get assigned to go take the training in Relias or another platform.
Thanks. Yes, and I'll be happy to explain that. So once you've submitted your 3 preferred dates, again, you're going to get an email that will send or an invite to a Teams training session. And you do not have to have Teams. You can enter Teams through as a guest member, kind of like what you're doing with this WebEx meeting right now. And so once you've gone into the Teams meeting, they'll be able to share the documents with you. And it's a training group with 2 state-trained investigators and up to 30 provider investigators in that course. And you're able to ask questions and have interaction with those trainers at that time, because our intent is that you totally understand and have as much information as we can impart to you to help you to start in this process. Now, once you have completed the one-day provisional training and you have passed your test, then you will receive a subsequent email that tells you what your grade was, and you will receive a letter and instructions for your registration through the Quilt Institute. That training is going to be, again, on a virtual training platform, and it will be through the Quilts Institute, and you will have your coaching sessions and things of that nature through the Quilts Institute. It will not begin until September 15th, and that is going to run 45 days. The first come, first serve. So the first folks that get through the one-day provisional training gets preference at the TQI training. And remember, all providers have to have a trained provider investigator unless they're on that exception list by January 1st, and that is to include the choices providers.
Just to clarify, that's a trained TQI investigator by January 1st for all providers.
Yes.
The provisional will get you through from the start of
January 1st.
From 9/1 to, or 10/1 to January 1st.
Yes.
Thank you, Vicki. Okay. Someone asked about the training information that was given at the beginning, and it looks like, Vicki, you posted that where that information can be found. Next question. That's a question about RSM, it looks like, again. Next question is, I think, Shannon, if someone has completed the quilts training and a pilot, does that person need to do the one-day training since a badge has not been assigned yet?
So if the person's a pilot participant, they either have been already badged and they have received notification from Quilts that they have badged, that they have assessed and credentialed and therefore gotten a badge. We still have some pilot participants that are in the process that might be remediating, that there's still expectation that they'll get badged, and you would not have to get once you badge, you do not have to get the one-day provisional training if that's the question. Once you badge, no, you do not need the one day.
Thank you. And that's even if they have not received, the badge has not been assigned yet, but they were told they completed.
Right. If they're being told they're going to badge, they don't do the one day. But now the reverse of that, the one day will get you, it buys you a longer period of time. So if you do the one day now and you're not a pilot participant, then you can sign up on, September 15th or that rolling calendar and take your full 45 days to get your TQI training. And so that's the reverse of that question.
Thank you. And Amy, I'm going to come to you with the next question. How is substantiated staff notified of their right for due process?
They would be notified via an election letter, an election form and a notice letter that comes out via certified mail following a Tier 1 investigation being substantiated, and that will give them all the information, the time frames, what they need to submit, to whom they submit, et cetera.
And just for clarification, that form comes from DIDD. The providers do not have to submit or send it. That whole process will work through DIDD, correct?
That is correct. Mm-hmm.
Thank you. Next question. I do not mean any disrespect, but is this all for choices providers? We do not deal with ICS persons. This is very confusing because it is not determined what is applicable for choices providers. It seems you are mixing DID and choices, non-ECF. Can we get a training just for choices? We feel we are being set up for misunderstanding and failure. I'm going to direct that to Shannon or the MCOs.
Sure, I'll start it, and I'm glad for the MCOs to join in. So yes, the reportable event management is for choices, home and community-based programs, right? So choices groups 2, 3, group 2 and 3. It's the same reportable event form, it's the same training, it's the same requirements as employment and community first choices and a 1915C and the ICF IIDs. It is different than what we have now. It's new and different training that we've been talking about since February, but the requirements are the same across the board for all those HCBS programs. We did do a choices specific training back this summer, early summer. I do recommend that you go to that training. It's on the website. It's on the DIDD REM website. There's kind of the host agency for that. Go to that, review that. If you have additional questions, I do recommend that you reach back out to us. The MCOs will be glad to work with you, the MCOs that you contract with. Hope that's helpful.
Thank you, Shannon. Skylin or Leanne, would you like to add anything?
Yeah, I think, and I don't know who asked that question, but I think please do feel free to reach out to your provider relations representative if you feel that you need more information or any one-on-one assistance from us. From an MCO perspective, you may be contracted with all three of us, and we might be able to assist you jointly. If you're not contracted with all three of us, just reach out and let your PR rep know, and I'm sure that any of us would be willing to help you further. But we have had multiple choices, choices-specific presentations. So there are some out there. I know that ours is still pending. The PowerPoint training itself is still pending legal approval to be uploaded onto the website. However, the recorded WebEx should be on the website, like Shannon was saying. So please do go and utilize that as a resource as you're learning on what trainings you need to be completing and getting those things done by January 2022.
Thank you, Skylin. Next question, I'm going to come back to you, Shannon. Will the one-day investigator training and subsequent TQI trainings be paid or reimbursed to companies for employees who complete the trainings?
Yeah, so how it is set up is that the TQI training, one provider, if you're one provider investigator, will be paid for your agency. If you're a statewide agency, then you'll have one in each region that will be paid for the Quilts Institute, and that's what we say TQI, Tennessee Quilts Institute Provider Investigation Training. Teresa, did I get that?
I think so, Shannon. And I just want to clarify something from earlier. I believe you stated earlier that the provider incentives partly were to try to help offset some of the costs that providers are facing for staff time. I want to be sure that was
Yes,
accurate.
thank you, Teresa.
And TennCare will be sending out additional information shortly on what that will look like.
Yes.
Thank you,
Yes.
ma'am. Okay, now, Vicki, choices only providers will start Tier 2 investigations 9/1 if provisionally trained, and DSPs for those choices only providers must complete the 1-hour training by 9/1. Is this correct?
That is correct.
And for further clarification purposes, all new DSPs will have to take the training, the RELIAS reportable event form training as they're hired. Correct, Vicki?
Correct, and it's been renamed to reportable event training
RET.
because it encompasses more than just the form.
Makes complete sense. We've already answered that. Liz, seizures lasting more than 5 minutes are now reportable. If that happens more than once per day, how many refs do we submit? 1 per day or 1 per each episode of seizure lasting longer than 5 minutes? And this is something normal for that person.
So we do not consolidate the medical ref. So if they had a seizure in the morning, you would submit a ref on that. And if they had one at that night, you would submit a second ref on that so we can track it individually.
Okay, Liz, what about the monthly reporting form? Is that applicable to the medical events or only the behavioral events that
Only the behavioral.
Only the behavioral. Thank you, ma'am. Okay,
I'm sorry, Teresa, is this an opportunity where we can talk about chronic diagnoses, Liz?
Well, this part of we can't, but you're more than welcome to.
No, Liz, just Liz. Liz. I'm volunteering Liz.
Liz, is that something you feel comfortable talking about right now?
Well, I can tell you that a chronic condition, what we say is that it means a health condition that's persistent or otherwise long-lasting in its effect, or a disease that comes with time. So that could be something like Alzheimer's. So the term chronic is often applied when the course of the disease is for more than 3 months. So what the provider would need to do is they would need to ensure that any chronic medical conditions are included in the plan of care. And if it's not included and identified as a chronic condition, then you would need to submit a ref on it. If it is documented as a chronic condition in their plan of care, then we would not expect a ref to be submitted for that.
Thank you, Liz. Next question, Skylin, so I'm going to volunteer you. Is the MCO critical incident form being phased out on 9/1? Will the new REF replace this form?
Well, it's twofold, right? So
Right.
for those choices providers who are completing the reportable event management process and going through the provider investigation training, then the critical incident form would phase out for you as a choices provider. If you are not going through the training and you're not trained until through TQI and all of that, if you're not doing the 1-day provisional training, if you're not fully trained as a provider investigator until, what is it, like 12:30 basically. So by January 1st, then you can utilize the critical incident process, reporting process, but from starting, as just going forward. So nothing changes for you until January 2022.
Thank you, Skylin. And just to clarify, that is for choices only providers, as you described. For providers who may provide choices in ECF or choices in 1915C, they will start with the new form in all programs on 9/1. Is that correct? Yes.
Yep.
Thank you, ma'am. Okay, next question. And Liz, I think I'm coming back to you. If a person is diagnosed with a UTI or cellulitis at physician's visit that is not reportable because they didn't go to the emergency room or urgent care, is that correct?
That is correct.
Hey, Liz, don't go anywhere. To clarify, can you please explain when a fall is reportable when it is a minor injury, such as an individual falls and gets a small scratch or cut on their leg, and only basic first aid by their support staff at their home is needed? Is this reportable?
Yes, that would be considered a minor injury if they had a scratch, if it was basic first aid.
Okay. Next.
And this is Shannon. I'll just add to that. We have a few, and Liz, correct me if I'm wrong, if I shouldn't be chiming in here, but there are a few things that are considered other additional reportable events, and falls are one of those. So falls are reported if they have a minor.
Falls,
injury.
correct. Falls with injury, minor or serious. If they fall and don't hurt themselves, we don't expect a rep on that one.
Okay. No, in the documentation, it has fall with minor injury as being reportable. Are falls without injury reportable, not reportable? Just want to clarify.
Falls without injury are not reportable. It's just falls with injury.
Okay. I'm going to go to you, Vicki. Provider investigator 1-day training. Can we get our graded tests back so we know which ones that we missed?
Yes, if you have completed the test, you do get your test results back. And if you failed to pass and you scored between 70 and 80, we are providing a remediation training on Fridays to go over that material that you may have misunderstood or didn't fully comprehend, and then allowing you to retest. Once you've retested, again, we'll score that and provide you your test results. So typically within the following business day after you have submitted your test, let's say you submitted on Friday, you won't get it back till Monday, and so on and so forth.
Thank you. The next question I'm going to just throw out there. I know that we had some discussion about this a few weeks or maybe even months back. It is my understanding that choices providers have different training requirements for staff, such as CPR first aid is not required. Just to clarify, each service's training requirements will be considered when investigations are being conducted for that specific service, correct?
I'll speak up, Teresa first, and then the
Thank
MCO.
you.
So yes, you're right that we discussed this maybe on the choices training about the CPR and the first aid training requirements have not changed for the choices, and you know what training requirements when they're looking at investigations that will be taken into consideration. We won't be looking for someone to have CPR training if that's not a requirement. MCOs, feel free to chime in.
All right, hearing nothing, I think that was a pretty comprehensive answer, Shannon. Thank you. Krista, we will have someone reach out to you with the link for or how to locate in Relias. If you saw Vicki posted earlier, the information for our Relias help desk at DIDD, that should be the person you would reach there should be able to assist you in being able to locate that training. Next question. If you are a provider who only does minor home modifications and assistive technology, do we still need the training? Vicki?
I apologize. I was answering a question to Kay to let her know that her test is going out. It has gone out. So can you repeat the question?
Do minor home modification and AT providers still need the training? There's more than one training.
So let's clarify. Yeah, if this is the one-day provisional investigator, they are, if you'll look on the DIDD webpage for the REM webpage, there is a list of all providers that are required to have a provider investigator, and there's also a list that identifies all the providers that do not have to have a provider investigator. So if you're only doing home modifications, if you're doing meal deliveries and things like that, you are not required to have a provider investigator. If you have not registered someone for that provider investigator position, I recommend you look at that list. In addition to that, we have posted a list of those providers that have someone that has registered for the TQI training or the quilts training, and we have a list of those providers that have not registered for either the TQI training or the provisional training. So again, please go to the webpage. You can look up your specific provider name. You can see what your status is. And then if you see that your name is on there, you can look again at the bottom and see what the provider list says for those services that require a provider investigator and those that do not. And if for some reason we've made an error, then just let us know and we'll follow up with the MCO or whomever you're contracted with to ensure that you are not required to have one. But again, if you'll look at the list, if your name is on the list, then at this point in time, you are required and expected to have a provider investigator. And again, that's on the DIDD REM webpage under the provider investigator training.
Thank you, Vicki. I do want to clarify though that what about the training that is in Relias, the reportable event training? Who's required to take that?
Yeah. So again, the videos that we previously had to kind of introduce everyone to this new world that we're moving into are now optional. Those are not required trainings. The only required training for all staff is reportable event training. The only additional training requirement is for those identified staff within the provider agency that is responsible for event management or the provider response team that will go in and do the PRERT training, which is the provider response, reportable event response team training.
Thank you, Vicki. And I just want to remind everyone again, if you go into the chat box too, if you scroll down and right past Vicki Loveday's name, when you get through the panelists, it says everyone, and then it starts listing the attendees. I don't know why WebEx puts it there. It's very awkward and it is difficult to find if you don't know, but that is where the everyone button is located if somebody wants to send a comment. Next question. Skyline, I think you answered the original. So my question about the outside of service incident should have been if the provider investigator needed to investigate the discovered incident if it was a tier 2.
going to hold true to yes. Yes, if it was reported to you, it's a reportable event, right? So if an event was reported to you and you've looked at your quick reference guides, your cheat sheets, whatever you've made, and it falls under reportable tier 2, then yes, you would complete that reportable event form, and it's going to be submitted over to DIDD, at which point the investigation specialist will review it as a tier 2 and guide you along the way to then begin your investigation of that event.
Thank you. Vicki, we're getting quite a few questions regarding folks not being able to find where to sign up for the one-day training. If maybe you could post that in the chat box, or again, tell folks. And just to clarify, unless you've been through the one-day training and have received your TQI quilts packet, you cannot register yet for the 45-day time frame for the quilts training. But that information on how to do that will be available in your packet once you have been through the one-day training and you have passed the test at the end of that training. Next question.
So if you have not registered someone to be your provider investigator, go to the DIDD webpage, go underneath provider investigator, and there is a registration form there. Open that registration form and it gives you where to submit that form through TeamCloud, because we have to have demographic information. We have to run a background check to make sure that nobody's on the statewide abuse registry or felony registry and things of that nature. Once that background check has been completed, you will receive an email from a DIDD investigation specialist informing you that you've passed the background check and you're ready to move forward. At the same time that you are submitting that form, if you have not previously registered, you need to tell us 3 dates that you wish to attend that training. Please make yourself available for the dates you're requesting, because if you do a no-show, you're then preventing someone else from attending that course. If you have already registered and you have already received your notice from the DIDD investigation specialist, all you need to do is to submit an email to the DIDD REM help desk and give us the 3 dates that you wish to attend. As in the chat, I noted that training runs Monday through Thursday between tomorrow now, between 8:27 and 9:09. Those are the only dates you can select, Monday through Thursday.
Thank you, Vicki. I'm going to try to. Yes, ma'am. Go on.
Can I piggyback on that? So for everybody, and just confirm, Vicki, so if you take the 1 day provisionally approved to be in a provider investigator training, you can begin, after you pass in all of that wonderfulness, you can begin your provider investigation starting 9/1. So that allows you to get your practice in for as you're, signing up and getting going into your TQI training. So it gets you kind of the hands-on experience as you're then beginning your training piece when you do start your TQI training. So it is a huge benefit for providers across the board, not just, from a choices perspective and ECF, which is my land, from any provider perspective. If you do the day one, or the 1 day training, then you can start as a provider investigator 9/1 doing your own investigations while you're awaiting your enrollment into TQI and your badging.
That's correct, but it also does something else. If you do the 1 day provisional training, you will not be required to take modules 1 and 2. So if you do not take the 1 day provisional training, you're required to do all 7 modules. If you do the 1 day provisional training, you'll have the essence of the modules that would have been provided to you already in modules 1 and 2. So it really reduces the amount of hours that it would be necessary for you to complete the TQI training once that begins. So yes, thank you, Scotland. And you would be able to begin your investigations 9/1.
Thank you, guys. I think that answered the next question we had in the chat box as well. I would just like to add to that answer that if you are a choices only provider and you choose not to participate in the 1 day training because it is not mandatory for choices only providers, you must complete the TQI training by 12/31 and be ready to perform your own investigations on 1/1. That is the last possible date that you can complete that training. You must have a provider investigator no later than 12/31 to begin investigations on 1/1. The next question is, will therapy updated with the new ref? And Stephanie, the answer to that question is yes. That is a major part of what we're working on with TheraP, is to be able to have real-time reporting into the system. I think we discussed in the last WebEx that we're going to be starting a pilot with some providers with TheraP who are already utilize the TheraP system, for their agency on a private agency basis. But the plan is, once that pilot is through, that everybody will be using the ref within TheraP very shortly. Next question. Vicki, do we go to the Relias website to sign up for the one-day training?
Yes, and if you have difficulty with accessing Relias, I'll post the DIDD help desk for Relias right now. So.
Okay, Vicki, and follow up, I've only seen the reportable event spreadsheet, but not the actual form on the website. Could someone please send the exact link? Oh, and is that what you did right below, Vicki?
That's for Relias.
Okay, well, maybe someone can post the other one as well. There's a training grid. Okay, Vicki, how do we know who is on the exception list?
By going to the DIDD REM webpage. If you'll look under Provider Investigator, it has an exception list on the webpage.
Okay, Vicki, next question is for you as well. If you have a staff on staff that has previously been an investigator for the state, will that agency still need to have someone go through the program?
That depends. If that provider investigator completed the LRA REM transition training that we offered several months ago, then they are already approved. If they have left the DIDD investigations unit and moved to a provider agency and had not done that transitional training, and we would have that documented, then yes, they have to go through the TQI process.
Thank you, Vicki. Next question. Is my understanding from Tiffany, if an agency met all the initial deadlines for training agency-wide, that was 6/30/21 on Relias or REM website through DIDD, employees do not have to redo the revised trainings. Is that correct?
So I'm assuming they're talking about the reportable event training. That training has been updated, as well as the provider response team training. That was also updated when we made revisions to the due process system and some other changes to consolidate reportable event forms and things of that nature. If you completed that previous training, you do not have to retake that training course. And for those people that had completed the training, they were provided an updated PowerPoint of that material to let them know of those changes that were submitted subsequent to their initial training.
Okay, next question. For a COVID positive client, we are to complete a ref. That is accurate. Skyline, are they also to complete a COVID-19 positive test report form to the MCO?
I'm not sure of that answer.
Oh.
Yeah, I don't know. I don't know if that's a requirement still with the new reporting process.
Well, so I guess, Leanne, do you know, or is this one we're going to take back and we'll be sure to have the answer within the FAQ?
I would like to take that one back just to verify there's not another
Absolutely.
form that I'm not aware of. So we'll
Initially,
bring
the
that
form
one
came
back.
came from TennCare. So Shannon, is that something that you know
Yeah, so
about?
I think we discussed this once before. I think we want to streamline things, right? And I think we have a one reporting process. So we'll be reporting positive cases through this system for 9/1.
Right. So just the reportable event form itself and nothing extra. is what we're understanding then.
Yeah, and so I didn't hear the question. Are they saying they're currently submitting a form right now, something separate besides the reportable event form?
Yes.
There is.
So Shannon,
Yeah.
there is a questionnaire that they fill out that gives us additional details that are not included on the reportable event form. So I think this is really something we need to take back and have further discussion on rather than trying to make that decision at this point just for clarity purposes.
We can do that. Can take it back.
Sounds great. Thank you, everyone. Liz, if someone is admitted to the hospital for a chronic illness, is this reportable?
Yes, hospital admissions are reportable as we do a deliverable to TennCare with that information.
Thank you. Okay, next question is from Michelle. Hey, Michelle, it's been a long time since I've seen your name. It's good to know that you made it through the past year okay. As a choices provider, along with the 1915C and ECF provider for around 7 elderly members, we tracked from Thursday afternoon through Tuesday morning and had 13 ER visits that would meet the criteria of a reportable event. How are providers going to be viewed as having a vast amount of reportable events?
Okay, I can take that, Teresa.
Sure.
We don't view that negatively. You can't help that a person, has a medical event that they have to get treatment for. So we're understanding to that. What we're concerned about is we just want to make sure that you're reporting them.
Thank you. And the next one is also for you, Liz. If chronic disease is epilepsy or seizure disorder, are seizures lasting more than 5 minutes reportable?
If you document it in the plan of care and they were to get treatment at an ER or urgent care facility, we would not expect that you report that. But remember, document it in the plan of care, and this is related to treatment at the emergency room or the urgent care facility. Keeping in mind, relating this to the last question, if they were admitted to the hospital, we would need to know that.
Thank
And
you,
plan of
Liz.
care is referenced to an ISP, PCSP, person, centered support plan, an individual support plan.
Thank you, Skyland. That was really helpful. We call them so many things, but I think at integration, they're all going to be PCSPs, so that will be much simpler, I think, for everyone. I'm sorry, some questions are here twice because of how they've been having to be pasted. I just want to. When the new form goes into effect, will we continue to include the same notifications for reportable event that we include now?
Yes, you would still need to do the notifications as they apply. So when they're talking about notifications, this relates to APS, the case manager, conservators. That's what they're referencing.
Thank you,
There's a
Liz.
spot on the new form for those at the bottom of the form.
Okay, next question is from Beverly. Hey, Beverly, it's great to see you on here. Is a bruise considered a minor injury for a fall? If so, if the person fell and initially there is no bruise, but the next day a bruise becomes apparent, is it then reportable? Liz?
Yes, Beverly, a bruise is considered to be a minor injury. Keep in mind, we would not consider that late reporting if the bruise appeared the next day and you reported it then, because we understand that it may not have showed up right away. Just note that in your description of the event that the bruise appeared and was discovered, the next day.
Okay, Liz, you're not getting away yet, so please clarify if agency nurse advises to monitor someone. I think this is probably with a medication error. Then would this be reportable?
Yes, medical personnel.
So whether it's an outside or inside agency medical personnel, it's reportable.
Correct.
Thank you. Okay, another request to post the link to Relias, which I think we've done. Scrolling. Okay, question. Once you have passed the one-day training and registered for the quilts training, will we receive additional information that our dates are accepted? I'm going to you, Tiffany, Denton with a Y. I think you're still here from the Quilts Institute.
Yes, I am. Can you hear me? I had to switch over to audio.
Yes, ma'am. Thank you so
Okay,
much.
great. Absolutely. Yes. As soon when you register, you will receive information related specifically to the session that you're registered for. And you'll receive information about how to log into the platform, your password, everything that will be needed in order to complete the training portion through TQI.
Thank you. And Shannon, I'm going to come to you because this is a choices specific question. Again, I think there may be some confusion. You could clarify here. I'm looking for the general training requirements for choices only providers that was mentioned earlier on the web page, and I do not see it. Could you all clarify where this is located? I could just be overlooking it.
So the training requirements for choices are the same as everyone else. The difference is that you have an extended timeline. So you don't have to have your training for the one-day training until 1/1/2022, and you don't have to have the provider investigation TQI training until that day either. So that's the difference, but the training is the same. And if you're looking on the website and you're not seeing that, it's under, we've posted it. So we just need to go back and check and make sure people are seeing that reportable event training on the website. I'll go there now.
Also from an MCO perspective, we did send out some communication. And it had a list. It was actually the calendar. It's kind of a Excel format document of the trainings that were required, who it was required of, and that was kind of a mass distribution. So I'm not sure. It would have gone out to probably your upper management, executive management. So you might want to check in if these questions are coming. If that's not you and you're asking these questions, you might want to check in with that person who would receive the primary information from the MCOs, as it may not have gotten trickled down to you because that information was sent out. I do believe if it wasn't last week, it was the week before that would have had the list that we're looking for and that Shannon is referencing that is also uploaded. So it might be easier to access that way through that email with a very clarifying memo of the expectations of the trainings and reminders as well.
That came out on August 6th.
Thank you all. Liz, the new reportable event form asks for the reporter's personal phone number. Is it required that we share our personal phone number on this form? Seems like our work contact information would be appropriate and sufficient.
We have two spots for you to provide the work number and the personal number. So as long as you fill out the number, one of the numbers is fine. We don't expect that they both be filled out, but it is helpful.
Thank you, Liz. Let me scroll down. If an ECF choices provider has an office employee approved for provisional PI, provider investigator, and completes the quilts training, and something happens to that person that causes them to be unable to work for a long period of time, or they quit, how long will a provider have to get another provider investigator trained or to secure a contract with one outside the agency? Shannon? Shannon's still here. I'm sorry.
I'm here. I was on mute.
I
Yeah,
don't know
sorry.
if that's something that a final decision has been made on as to how long in between someone leaving till someone new can be trained.
I'm sorry, Teresa. I was on mute. I was making sure
Sure.
that I could find the reportable event training on the website since we had so many questions, but I went to it and it's there. So I hope everyone can find it now. And so would you just repeat that question?
I will. And honestly, it's a really good question. I don't know if it's something that has been discussed over at 10Care or not, but and I'm just going to make it a little bit shorter for you. The provider is simply asking if they have someone who is their investigator, who's been through quilts, fully trained investigator, and that person has to be out for an extended period of time, or that person may leave the agency. How long will the provider have to get another investigator trained or to secure a contract before they be out of compliance?
Yeah, really the expectation, and we can take it back, but the expectation is that the agency will have a provider investigator. And I think that's why some the agencies have been looking into second provider investigators. So we'll take that back to
Okay.
get any clarification.
Thank you, Shannon. Okay, Liz, so seizures that result in someone going to the ER for seizures are not reportable if seizure epilepsy are noted in the person-centered plan or the person support plan as a chronic condition. On another occasion, I thought I understood that all seizures are reportable if the person has to go out for evaluation. Can you clarify?
Okay, so if the person has a seizure and it is documented that seizures are a chronic condition in their plan of care, then they went to the emergency room and got treatment. We would not expect a rec on that because it's documented as a chronic condition. So if they had a seizure and it's not documented as a chronic condition in their plan of care, we would expect a report on that.
Thank you, Liz. The next question I think I could answer is how much is it to contract with a provider investigator outside the agency? Donna, that would be an agreement between your agency and whoever that independent investigator may be, or another agency to utilize their provider investigator. It's not something that would involve DIDD or the MCOs, and there's no set amount or that the cost would be on that. That would just be negotiated between the two parties that wanted to use that arrangement. Now, that looks like it's the last question in the chat box. What I would like to do real quickly is circle back with Vicki. And Vicki, I think if you can very succinctly go through one more time what is expected and what was in that memo regarding the one-day provider investigator training, and then the full TQI certified investigator, just so we can be sure people are fully understanding what dates by which things need to be completed.
Sure. So first, I'd like to direct everybody again to the REM webpage. And under there, there's a section that has announcements, and that's where you can find the memo that went out through the MCOs as well as the IDD through the listserv and to all of our providers. If you look under the August 12th, our last presentation, where we went through all the training requirements and the timeline, that is part of the FAQs from August 12th. So you can pull up those FAQs. You can see the charts there as well. That's where the training is located. Again, the training for the one-day provisional training runs from now until September 9th. September 9th is the last date that any waiver can attend that training. If Choices members would like to attend the one-day provisional training and take advantage of those incentives, then they must enroll and attend that training before 9/9. Every provider must have a trained provider investigator by October 1st that are any waiver other than Choices. Choices must meet a January 1, 2022 deadline for their provider investigator. And again, TQI or quilts is not going to start until September 15th. So if you are waiting for quilts, you are not going to meet your requirement for October 1st deadline for a provider investigator if you are a ECF, 1915C, Katie Beckett, or ICF provider.
Thank you, Vicki. Vicki, we had one more question pop up, and that is, do we have a list of provider investigators offering their services to other providers?
We do not post those provider investigators, and the reason for that is that we have a list of those providers that have an investigator that are certified or have registered, and most people would make that business arrangement with that other provider agency. We do not have any independent provider investigators that you would contract with. At this time, the only provider investigators that are available are through other providers that are contracted through the MCOs.
Thank you, Vicki. Okay, we're going to pause for just one moment just to see if any other questions pop up in the chat box.
And Teresa, I see one question that says we're yellow on the provider list. What that means is if you are yellow, that means that we do not have anyone registered by your provider to be a provider investigator. That registration form for that provider investigator has not been submitted by your agency.
Thank you, Vicki. I also want to just take a minute to remind everyone that on the REM website, we put up the recordings from these meetings. So if anybody wants to go back and listen, if you missed anything, then you can go back and you can listen to the recording. And we also post the questions and the answers, both the pre-submitted and the questions that came during the WebEx into our FAQ document so that they're available there as well. Should anyone want to go back and review or go and look for the answer for a question. I'm going to ask the panelists real quick if anybody has anything they want to say. We'll give them a moment, and then if there's no more questions, we can sign off till next time.
This is Shannon. I just want to thank everyone for all the questions. I can tell by the questions that everybody is gearing up for those important dates that are coming up. So we really appreciate your involvement, your questions, and we look forward to the next meeting that we have, or the next WebEx we'll have. I think it's on September 9th as you start implementing, and we'll be here to answer questions along the way.
Thank you, Shannon. And Vicki, we did have one other question pop up real quick, asking if there's a list to double check that you are on the list of completion before October 1st for having a provider investigator.
So we do not have a comprehensive list out there right now for the one-day provisional investigator training. We are currently engaged in those actual training sessions and registering people for that training. That list would not be available until after 9/9 because that's the last date of the training as well. And if you have, if you believe you have registered and you have not seen your name, or you see, or it reflects that you're color-coded yellow as not having registered, there's not a yes beside your name in that box, please send me your provider name and a copy of that registration, and I will follow up on it and make sure that our system is updated with that information.
Thank you. Vicki, how do we add new staff to DIDD Relias website for the training? These people weren't on the original spreadsheet.
So if you go back into the prior WebExes and the FAQs, that open enrollment period for those bulk uploads has passed and ended. What you have to do now is go through your administrator for Relias, a provider administrator, and you enroll them through your own system now. If you need assistance with that, use that website that I provided you for, not the website, the email for our training department, and I'll repost them because it doesn't say training, it says ISOA is our training department, and I'll post that for you right now.
Thank you, Vicki. All right, well, looks like that is all of the questions, and Vicki just posted the Relias email. So hearing nothing from anyone else, I think we will go on and we will conclude this WebEx. We thank you all for participating. And as I said, for the remainder of the bi-weekly WebExes we'll be using that time for all question and answers. So any questions you can submit beforehand to the Relias mailbox are welcome and appreciated. And y'all be safe, and we'll see you again on the 9th. Take care.